Good afternoon. Happy Friday. Looks like it's going to be a nice weekend, so hopefully everyone can get outside. I want to thank you again for tuning in. We're doing these now Monday, Wednesday, and Friday at 1 o'clock. We'll continue with that next week. This week we've had a lot of news with schools. I have some new announcements today, and I expect the same will be true for next week. So I would ask you to continue to tune in. If you'd like to get daily updates, you can go on the governor's office website and sign up for daily COVID email updates. We have many thousands of people who are doing that, and we get good feedback that it's a useful source of information. What I've been saying from the beginning is truer now than ever. Keep yourselves informed. The best thing that you can do is to stay up to date. The virus is changing, information is changing, our ability to fight the virus is changing, so keep yourselves informed so you can keep yourself and your family safe. We will start, as we always do, with the data. Please put that up on the slide. Again, it's another encouraging day of data. We've had another 84 cases, so continued steady decline in cases, steady decline in hospitalizations. Sadly, another 10 deaths. It's tough every day to report double-digit number of deaths. So even though we are moving in the right direction in every way, I would just ask everybody, please, to keep in mind and remember every day we're losing Rhode Islanders to this virus, which means we have to stay on it. We have to stay vigilant. I would say, you know, I look at the data every day in great detail. How are we doing with our percent positive? How are we doing with our percent positive in the areas that have been most affected? Central Falls, Pawtucket, North Providence, parts of Providence. It's all trending in the right direction, which is great and reassuring. But just remember, the virus hasn't gone away. Our numbers aren't trending in the right direction because we have a cure or a vaccine or the virus is gone. It's tending in the right direction because we've changed. The virus hasn't changed, we've changed. We're wearing our masks, washing our hands, staying 6 feet apart, limiting our being in big groups, staying out of big groups. So we have to keep doing that. And if we keep doing that really vigilantly, then we're gonna, get back to business as usual. School kids are gonna go back to school. We're gonna have a good summer, but it's totally dependent on every single Rhode Islander following the rules. And I suspect it'll get harder as the weather gets nicer. So I'm going to continue to ask you for your amazing cooperation and rule following, just as you've done the whole way through. Okay, a couple of announcements today. It's Friday, so I'll try to keep it short. But I do want to take a minute or two to talk about testing because it is such a key piece of the puzzle. So a few days ago, earlier this week, I talked about our 3-part approach to testing. We call it SOS. The first S is symptomatics. If you feel sick, we want you to call your doctor and get yourself tested right away. And our commitment to you is to get you tested and have your results within a few days. That's if you feel sick. The O is for outbreaks. I think there will be outbreaks, and I don't want you to get scared when they happen. They're going to happen. In a nursing home, maybe in a school, I don't know where. In a camp, in a manufacturing operation, in a grocery store, in a restaurant. We are prepared for it, though. That's the thing. We'll be there within hours. We will test everybody. We'll do contact tracing, and we'll get folks into quarantine and isolation. And then the last S is what we're calling surveillance testing, just constant testing of people who don't have symptoms, just to get a feel for the prevalence of the virus. Now, a lot of you have said to me, why are you doing this? Because it is true that the test is much more accurate if you have symptoms. But some information is better than no information. And we've learned from our experience in nursing homes that often we will test somebody, they will be positive, and then a few days later they come down with symptoms. So being as how in this virus, literally every minute counts. Time matters, speed matters, an hour matters, a day matters. In order to stay ahead of the virus, that's our goal. We never want it to overtake us. We want to stay ahead of it. We have to be doing a lot of continuous testing of people who aren't sick. And yeah, we're going to get some, imperfect information, but we're also going to find a lot of people early before they show symptoms, and we're going to have a feel for what's going on in the manufacturing industry, what's going on in nursing homes, how prevalent is the disease among barbers and hair cutters and grocery store workers, because that'll allow us to get ahead of it before there's an outbreak. So earlier this week, I announced a new system for testing close contact workers, folks that work in a hair salon, barbers, nail salons, gym employees, tattoo, massage, tanning parlors, childcare workers. If you're in one of those industries, I'm asking you to please go get yourself tested, even if you don't feel sick. I know there's some confusion about this, so I'll try to clarify it. If you are in one of those industries and you feel perfectly fine, I'm asking you please to go get yourself tested, not because we think you're sick, but we want to know if you are, and we want to know what's going on in that population. We are providing this for free. It won't cost you anything, and you can go to one of the sites at RIC or CCRI, staffed by the National Guard. These guys are pros. I was tested just the other day. It did not hurt. They're fantastic. They've done thousands of these. Don't be afraid. And I would encourage you to do it. We have capacity to run 900 of these asymptomatic tests a day, but right now we're only averaging about half of that. We've been doing about 400 a day of asymptomatic people in these close contact industries. So, that's not good enough. I'm not satisfied with that. We have to do better. So I'm asking you, please, if you are hearing me and you're a barber, you work in a gym, one of these close and contact businesses, you work at your child care worker, if you could please just do it for Rhode Island. This is like you're doing your part in the public health effort of Rhode Island. If you can just spare like 15, 20, 30 minutes, get yourself a test, and it will help us a lot. So to that end, since we're not where we want to be, we want to be at the 900 a day, I'm asking you all to do it, do your part, but I'm also announcing that we're expanding our asymptomatic testing program to include restaurant workers and bus drivers. This is a big one, and by the way, I also want to say I'm hearing from a lot of Rhode Islanders who are still afraid to go out to eat, still afraid to ride the bus, still afraid to get their hair cut. So the more we test waiters, waitresses, hair cutters, and get a feel for the prevalence of the disease, it is my hope that it'll also get Rhode Islanders to be more confident that it's okay to go out for dinner. It's okay to go get your nails done. It's safe, it's fine. So if you fall into one of these categories, which now includes restaurant workers and bus drivers, you can go to portal.ri.gov, or you could call the Department of Health, 222-8022, and sign up for an appointment to get yourself tested. And remember, please, this is if you feel well. This is not if you're sick. If you're sick, I want you to get tested immediately. Call your doctor, go get tested. But this is if you feel fine, you're a waiter, you just want to know, you want to do your part for Rhode Island. You can tell the folks you wait on, hey, I was just tested, I'm negative. This is something we're asking you to do. And I would love it if I'm here next week and I can say we're doing 900 a day. That's our goal. We're at 400 now, 900 asymptomatic tests every day. That's where we want to be. So I'm asking you for your help. Another quick note on testing. Dr. Nicole Alexander-Scott and I have been up here day after day drawing attention to the need for having an equity lens on everything we do in meeting the needs of the crisis, and with a particular focus on the communities that have been hardest hit which are our most densely populated communities. Central Falls, Pawtucket, parts of Providence. I've said it a million times. These communities are hard hit. Good news, a week ago, the test positive rate in those communities was still above 20%. Now it is below 20% every place. In fact, in certain places, I think in Pawtucket, it's even at 10%, which is where you want to be. The gold standard is 10% or below. But we're not where we need to be, not where we need to be. We have to do more testing in Central Falls, more testing in certain areas of Providence, more testing in Woonsocket and in Pawtucket, which means we need to get into the community, and we are committed to doing that. So for today, I want you to know we're committed to doing that. We have plans in place to roll out more testing sites starting next week in these communities. We don't know exactly where today. We're trying to find the best locations that are the most centrally located and convenient and easy for people in the community to walk to or take a bus to or drive to. But I wanted to, I guess, let you know today as we're ending the week, the data is very much trending in the right direction, even in those communities. And by this time next week, we'll have more testing centers in the communities that are hardest hit. And we are committed to it. We are committed to equity and making sure these communities are safe and healthy, and we know what's going on there with the virus. Okay, two other quick announcements. Today, we've been talking a lot around the vulnerable population. I've said so many times, if you were poor or homeless or housing insecure or unemployed before the crisis, this pandemic has hit you the hardest, and I'm sorry, it's been so tough. I know it's really hard to put food on the table, hard to take care of your kids, hard to keep a roof over your head. And so the whole time we've been responding, we are trying to help you meet your most basic needs of food and shelter and medical care. So today I have a special request, and I think opportunity for Rhode Island's landlords. I have asked everybody to pitch in here. At different points, I've been up here asking everyone to do their part. And you've all said yes every time. It's been amazing. Today, I'm asking landlords to step up and do your part. Right now, and I do believe, and we've come up with something that will help you and your businesses while you help people who need a place to live. So I've heard from a lot of landlords, it's a tough time to rent a vacant unit right now for obvious reasons. Also, we have a lot of people who are just housing insecure or homeless or on the verge of homelessness. So a few weeks ago, I announced that we had a $5 million initiative to provide more affordable housing. Today, I'm proud to announce that as part of that, one of the ways we're going to use that money is that we're going to be supporting Rhode Islanders who qualify for housing vouchers, but who often have a hard time finding landlords who are willing to rent to them. I would say that's always wrong. I have stood firmly in favor of ending discrimination on the basis of source of income. But now, during this crisis, it's especially wrong and especially problematic. So we are launching an initiative called the Housing Now campaign. We're launching this in partnership with the United Way and with the Rhode Island Realtors Association. Thank you to the United Way, and thank you to the Rhode Island Realtors Association. You guys have been great partners as we try to figure out a creative solution here. So here's my challenge to the landlords of Rhode Island. I'm challenging you to pledge at least 100 rental units by the 1st of July. 100 rental units by the 1st of July to be rented to folks that have housing vouchers. It's an aggressive goal. I realize that. There's only a few weeks left, but I'm a firm believer that if you aim high and set a goal, people will get there and they will act to achieve the goal. And this really is a matter of life and death. Homelessness in this crisis is a matter of life and death. So here's how it's going to work. We're going to give landlords a $2,000 signing bonus for the first unit that they make available to serve a household experiencing homelessness, and an additional $500 for every additional unit. We're also going to offer landlords up to $2,000 a unit to support upgrades, move-in upgrades, like minor renovations and repairs. Again, this is part of the initiative I announced weeks ago, and we think this is a very creative way to quickly help families who are struggling with homelessness. Landlords will benefit because I've heard from you and I've heard from the Realtors Association, it's a hard time to rent. You have a lot of vacancies, a lot of turnover, and could use a hand in fixing up some of these apartments to get them up to code. So I think this is a win-win, and I'm asking you to pitch in to help the people of Rhode Island. The quickest, easiest way to get information about this is to call 211. So again, thank you to the United Way. You could call the United Way 211 and you could get information. That's the quickest, easiest way to get information. If for whatever reason you can't do that, you could call the Rhode Island Realtors Association. You could always call the Commerce hotline, 521-HELP, but the best way to do it is through the United Way 211. So I hope on July 1st I can get up here and say we've given housing to 100 families who otherwise would have been homeless. And in fact, I hope it's more. I hope we do more. Last announcement today relates to a transparency portal. Hopefully at this point everyone knows that thanks to the extremely hard work of our federal delegation led by Senator Reid, we, Rhode Island, have secured $1.25 billion in COVID emergency relief monies from the federal government, and we're working hard to figure out the best way to use those funds to meet the needs of the crisis. I have pledged from the beginning total transparency about where that money is going. And today I'm making good on that pledge. Later this afternoon, I think probably right after this press conference, we're going to be launching a website dedicated to tracking all of our coronavirus spending. It's at transparency.ri.gov/COVID-19. Every single penny that we spend from our COVID stimulus fund will be accounted for on this website. So all the money we're spending on vendors, contractors, hospital surge, PPE, testing, contact tracing, et cetera, will be listed and updated we're going to aim for a monthly basis. That's hard, but the team tells me we can do it. On a monthly basis, refreshing that so everyone in Rhode Island can go there, and if you're interested, see how we're spending the federal government's money to meet the needs of the crisis. And I do want to thank Director Smiley and his team. They're buried in work, but I'm really happy to be able to announce this today. It'll be online today. At this point, only a handful of other states have done this, so we're ahead of the pack on transparency, and that's where I'd like to be, and that's where I'd like to stay. I think everyone deserves to know how your tax dollars are being spent. So with that, I'll turn it over to Dr. Alexander Scott and come back for questions.
Thank you, Governor. Good afternoon, everyone. Thank you for joining us today. I'll get started with the data. We have 84 new cases of COVID-19 to announce today. In addition, there are currently 141 people with COVID-19 in the hospital. Of these 141, 28 are in the intensive care unit, and 17 of those 28 are on a ventilator in the ICU. Sadly, we have 10 additional COVID-19 associated fatalities to report today. Each of these lives matter. 3 of these people were in their 60s, 3 of these people were in their 70s, 1 of them was in their 80s, and 3 of these people were in their 90s. Reporting these numbers every day, every week, continues to be very difficult. Our hearts and sympathies go out to families and friends of these precious Rhode Islanders. who we have lost. That information motivates us to continue to do our best to stay in front of COVID-19. In terms of our number of new cases, we continue to be in a steady, good place. One of the reasons why we have been able to achieve that is because of our aggressive approach to testing. As we have outlined, we have a three-pronged approach. The first strategy is testing everyone who has symptoms, which we've been doing since the beginning and will continue to prioritize getting them tested, identified, if they are positive, into isolation, and also contacting the people who have had direct close contact with them so that they can be quarantined and monitor themselves for symptoms. That is the primary way for us to stop transmission of this virus. The second strategy, as the governor shared, is the outbreak rapid response that allows us to really be aggressive in settings that are at higher risk, such as the congregate care settings and in communities of color or communities where the population is more dense. That way we can really wrap our hands quickly around a place where there may be a case and identify if there are any more before it becomes too big. It helps us stay in front of what's needed. Finally, our third strategy is the Sentinel early warning system. As the governor just shared, we announced earlier this week that we opened COVID-19 testing to people in certain high contact occupations. And we thank you and encourage you to get that test because it does give us more information about people in high contact occupations in a way that can be helpful as we're moving forward, reopening the economy. It's extremely important that our priority continues to focus on the communities being hardest hit across each of these three elements of testing, including the Sentinel early warning system. We want to make sure that we're offering testing to people who are from communities of color, and we're continuing to do work to offer testing in those communities so that it can be accessible for asymptomatic testing to occur and help fully inform our Sentinel early warning system. The health of people in the communities being hardest hit and the health of the entire state depends on our ability to get resources into the communities that are most impacted. We are working hard, but the reality is that we are still seeing the disparities when it comes to COVID-19 in Rhode Island, and it's clear to us together that there is more for us to do. So we want to emphasize that as we are encouraging high contact workers to get tested, we specifically want to make sure that people who are from communities of color respond to that and know that in the coming weeks, we're working on getting that testing even more accessible to you in those communities. We've also seen disparities when it comes to serology testing or antibody testing. Many reporters joined Dr. Phil Chan earlier today. He is one of the consultant medical directors at the Rhode Island Department of Health on a call to discuss serology testing. As you may recall, we randomly selected 5,000 households from all over the state and mailed letters offering voluntary serology testing at one of several Stop and Shop locations throughout the state. Serology testing determines whether someone has antibodies for a virus, indicating whether they have been previously exposed to that virus. Thanks to our COVID-19 testing and validation task force, we have more information that helps guide us as we're interpreting serology testing. The entire nation is learning, but because of the experts we have, we can slowly understand that using these serology tests to help us understand the landscape is a helpful tool for us. We also still know that it is not yet ready for interpreting test results on antibodies at an individual level. We have learned, based on the results, that COVID-19 seroprevalence for Latino Rhode Islanders is roughly around 8.2%. So that means 8.2% of the Latino Rhode Islanders who were sampled and received the serology test seems to have been exposed to the virus based on the results of the test. Similarly, for African American Rhode Islanders, it was 5.2%. The disparities are present because we understand that for all the Caucasian Rhode Islanders who were sampled, the seroprevalence was roughly 1%. So it's clear that a lot more work must be done when it comes to disparities, and it's what we are all laser focused on together with the governor's leadership. The important overall picture from the serology testing that's helpful is that for all people sampled, 2.2% was the number seroprevalence of people who showed a positive serology test result when you look overall. So that's comparing the overall number and then also being aware of what happens when we look by race and ethnicity. One of our operating assumptions throughout this response is that there are a number of additional people who are COVID positive that have not been tested as of yet. So with that working assumption, that 2.2% number that we have is relatively low overall. And we can look at the data also to learn how to help assist in areas where we're seeing the differences in the numbers. Another important point to make is that there's still a lot we're learning about COVID-19. And that's why it is very helpful to know we're one of the first states to have done this type of statewide assessment. We don't know yet whether COVID-19 antibodies will actually be protective against COVID-19. So this information allows us to help learn a little bit more. It's valuable, but we still have that caveat in place, which is why it's not intended on an individual basis, but to continue to help us assess at a population level. So I want to finish with thanking all of the people who worked very hard to coordinate this statewide serology testing effort and to do the data analysis. In addition to Dr. Phil Chan, whose expertise has been a huge asset for our response in Rhode Island, I want to also thank our tremendous state's COVID-19 testing team, who really worked hard in a short amount of time to get this activated and to get us towards the results we're able to learn from. We also have wonderful partners at the Brown University School of Public Health that we are grateful for. And then finally as well, our Brown University Policy Lab, all working together to help us learn more and keep Rhode Island at the forefront as we're going forward. So with that, I will get us going with questions.
Dr. Alexander Scott, as you're now starting, and you kind of touched on it there, but to test asymptomatic people regularly, are you finding asymptomatic cases? You know, when a hairdresser shows up who doesn't feel sick but gets a test or a massage? So I know it's early days, but what are you seeing so far with that?
Yes, it's still early on, but we are anticipating that we will see cases. But the serology results that I shared, this less than 5% type of number is what we are anticipating we will see across the board with the early warning sentinel testing that we are encouraging the specific workers the governor mentioned to get tested. But that's the focus of doing it, helping to see what else can we learn, what other interventions can we put in place, how else can we support those people who are high contact workers and doing a good job in providing services throughout the state.
Doctor, I was on the call with Dr. Philip Chin this morning. In fact, the article, my article on this will be up on motifri.com. But one of the focuses on that was, what do you think are the implications that there's such a radical disparity in seropositivity between races and ethnic backgrounds? In other words, my rough calculation is that Latinx people are about 3.7 times more likely than the average the overall population to have seropositivity. The African American population about 2.4 times as likely as the overall population, and yet the white population is 0.4 times as likely. In other words, less than half as likely as the overall population. And what are the implications of that as distinct from PCR testing disparities, which are different, going forward in terms of what the Department of Health and the state are going to do about it?
These data are in alignment with what we have seen with the PCR testing. And as I've mentioned, the serology tests are giving us information that we're learning more about. I'm interpreting that it means there has been exposure to COVID-19 in the populations, and given everything that we have described, the strong and resilient communities that are more densely populated and where there are communities of color are more exposed. So it is not surprising when you see serology results that reflect that. The time will tell whether or not we're able to say that that higher seroprevalence then means that someone is not at risk of getting reinfected with COVID-19, and perhaps it adds to the ability of certain communities to be able to advance forward in certain ways. So we will still be taking in these results, doing additional analyses, and leading the way across the country in helping to understand how else we can interpret this.
The expansion to bus drivers, does that include taxi drivers, Uber drivers, Lyft drivers, and if not, why not?
We're focusing on the public transit at this point. We have a designed Sentinel early warning system program testing approach for these 3 months, and that's how we decided to start with those specific high contact workers. After these several months, we will be collecting that data, analyzing it, and then reassessing what is the best path as we go forward. With each month, as we all know, we all learn a tremendous amount more about COVID-19, and we'll have more information about the best next direction to go.
In sort of layman's terms on two fronts. Number one, I hear from people, I'm sure we all hear from people, that I'd love to get tested because I think I had COVID in January, or whatever it may be. From a supply chain standpoint, how far away are we from a point where most Rhode Islanders will be able to have a serology test? Is that even something that's remotely on your radar screen? And then secondly, I guess more opining on those who would push the notion of herd immunity as something that we may have already encountered or are moving towards as we continue to reopen the economy.
So your first question applies specifically to a serology test, as you shared, and I want to make sure that that's clear, because the type of testing that we are encouraging high contact workers to go get is not a serology test right now. That is a PCR test, and it's 1 point in time. So it is not helpful to get that type of test to understand whether or not you may have had COVID-19 back in January. The serology antibody test that I just shared this data on the specific study that we were able to conduct is the type of test that helps understand whether or not someone may have been exposed to COVID-19 in the past. As I've shared, however, we do not have enough information about the test that says it is valuable at this point for an individual to get tested and determine if they're positive. We're still learning, even if someone has a positive PCR test and a negative serology test, what does that mean, or vice versa. So we are continuing to keep it a population level learning experience at this time and are not yet ready to recommend it at an individual level for it to be a useful test, because nationwide there is not enough information to interpret it in a way that's going to be useful, and we do not want to promote false security about someone's exposure to COVID-19 and what that means for protection with going forward. From a supply standpoint in the future, I think that that will be less of an issue, and it's more so having the appropriate information for interpreting those results, which we do not have for an individual right now. Given the seroprevalence results that are the less than 5% in general, we would have quite a ways to go before we could say herd immunity is something that we can benefit from at this time.
Good afternoon. Could I ask the doctor one quick question just based on what you just said there? What further steps could be taken to better understand if antibodies do produce that immunity? How can you kind of develop a better understanding of that?
Yeah, a tremendous amount of work is going on nationally to help get us there. We are just still early on. You know, we're just a few months into this virus. Many of these tests are very newly developed, and many of the previous antibody tests on other viruses take years for people to really understand how it works and what it means. And as an infectious disease doc for adults and children, I can say that even tests that have had antibodies, even viruses that have had antibody tests in place for many years, it's still tricky to understand the IgG, the IgM, how do we interpret it? So with much thanks to our COVID-19 testing and validation task force, who are nationally and internationally renowned experts, we are on the front lines of getting the data information that help us know how much more we can start to rely on these serology tests, but we still have a way to go just because we're still so early on in the development of them.
Governor, good afternoon.
Good afternoon.
Don't think we forgot about you.
Yes, exactly. I was on break.
On Monday, you told me that you would have clearer guidelines on weddings by the end of the week, and I've heard from a lot of couples. I've also heard from the wedding industry. Very anxiously waiting to hear what you have to say today.
So, by the way, we did look into the specific instance that you brought up, and I appreciate you bringing that up. So look, here's the deal. There's no new guidance for phase 2. Phase 2 is as it is. Social gatherings 15 and below. If you have it in a church or a synagogue or mosque, 25%. The rules are as they are. The question is, when are we going to get to phase 3? And as I stand here, I don't know. We like to do things for 14 days and observe for 14 days. So as I've said all along, what I've been saying is early July. So I know that's unsatisfying, but it is what it is. So we are going to, next week, I am hopeful that we'll be able to have clearer guidance. This I know we will do. We are going to give guidance next week around what phase 3 will look like. And I don't know if next week I'll be in a position to say this is the date of phase 3.
The question I'm getting is, flexibility and nimbleness with government. I understand you want to have guidelines, but the announcement you made several months ago, the data may look a little bit different now. And I know you want to wait as we go through phase 2, but the people that I've heard from since our article came out a couple of days ago is, how come restaurants, you could replicate this setting? You said for high school graduations, be creative and get under the guidelines. In this specific case, and others that I know about, they're getting creative. They're submitting plans for social distancing. masks, testing, temperature, all of that. So they're trying to do it and they're running up against a brick wall. So I wonder why there's no flexibility, and they see a double standard. Restaurants, you could accommodate 100 people at various tables, but I can't go wherever the venue is, spread out, socially distant. So why can't government turn a little bit?
Yeah. So look, it is a very fair question, and I am not pretending that these rules are perfect or convenient at all. We're doing the best we can, and the difference, we debated this endlessly, actually, this exact question, and here's where we came down. There's a difference between allowing, say, 50% capacity at a restaurant, which might have, say, 100 people at the restaurant, but there are 100 people who don't know each other, so they're not mingling with one another, right? We went out for dinner last night. We sat in our table, didn't really interact with the other people, and we left. If you have 100 people at an event, say a wedding, who all know each other, they're all going to be close to each other. They're going to be congregating. They're going to want to dance. There's going to want to be music. So for phase 2, when we're still trying to play it safe, we decided, and it's a tough call, believe me. It is a tough call, but we said, there is a difference between an event with mingling and everyone knows each other and a restaurant. So the best I can say is it's a few more weeks. Hang in there. If you can wait for your wedding to be in July or August, it's going to be easier. If you have to do it this month, which God bless, these are the rules. The rules are what they are, and we're going to follow them.
Phase 3, and I've asked your communications people, there's no ballpark number right now. So can you at least give people a thought in the internal discussions in these meetings that you have? 50, 75, 100?
That's the ballpark.
You got to be thinking about it.
Yeah, no, what you just said is it. 50, 75, 100. We're also, next Tuesday, I have a meeting with all the other governors to see what they're doing. That's exactly where we are right now.
Governor, after your announcement Wednesday about schools, I think some superintendents expressed some frustration that they were kind of caught off guard, maybe not in the loop, and some reservations about how practical some of these things can be done, even though the guidelines won't be out till next week. What's your response to that, and maybe creating a little more questions than answers, as you've said sometimes?
So first, let me say, I feel for them because they have a tough job. This is a tough job. We're going to do it. It's doable. But to start on June 10th or whatever and be ready for opening school with nearly all kids in school by August 31st, a lot of work to do. So if I were superintendent, I would be, understandably a little nervous and anxious, and I'd be getting to work, right? As they are. But the point is, I don't want to minimize how difficult it is. And as I said, when I announced it, I'm asking them to lead. They need to lead in a very difficult circumstance. The truth of it is, the commissioner has had lots and lots of dialogue with superintendents. They've known for a long time that they're going to have contingency plans, all in person, some in person, all virtual. So, we have been talking to them. By the way, we're going to continue to talk to them, right? So next Friday, we're going to have the guidance out. Between now and then, we'll be talking to them a lot. And then we're going to hold their hand the whole way through between when we give them the guidance and when their plans are due to us to make sure that they get it right.
Just to be clear, and I know a lot can change in the next couple of months, is your vision to have all kids in school? I know you talked about staggering certain parts of it and hybrids, but is your vision to have all kids in school at the same time, or could there be, again, like a day on and a day off, a week on and a week off, putting parents in a tough position?
I want to see plans for nearly every kid in school, like regular, every day. That should be our goal. We should be shooting for that goal. And everything we know now, like, the doctor just went through, if we stay on the trajectory we're on now, between now and August 31st, we ought to be able to do that. Now, maybe we can't, in which case they have to have contingency plans. But it is not enough to just have a plan for a hybrid model or an every other day thing, as you described.
Governor, the Christopher Columbus statue in Boston was vandalized, taken down. Should the one in Providence, in your mind, be removed?
It's an interesting question. It shouldn't have been vandalized in Rhode Island as it was. I think it's worth a discussion, I think it's worth a discussion. I have not, look, that's a difficult issue. It's a culturally important statue for many Italian Americans. It's also offensive to many others, and so I think it's worth a community discussion.
The debate is, I just want to follow up, the debate is renewed about the state name change. I believe I read this morning you said you would favor that, but short of putting it on the ballot, would you consider an executive action to remove Providence Plantations from any state buildings?
I would support, I think it should be put on the ballot this year. I have heard from so many African Americans in Rhode Island, actually, particularly in the past couple of weeks, as I've been really amping up my efforts to listen, that it's a painful thing to see. Like state employees, every time they get their paycheck, they have to see the word plantation. Every time you get a proclamation from the state for doing a good thing, you should feel proud about it. You have to see the word plantation. So I think we ought to do the right thing, put it on the ballot, ask the people of Rhode Island to do the right thing and change our name. I suppose if that is unsuccessful, yes, I would absolutely consider doing what you said.
Governor, following up on the school issue, can you clarify, I've gotten some questions about the 42 million.
Yes, thank you.
Where is that coming from?
Thank you for bringing that up. So the federal government gave to all states, including us, funds to be distributed according to a federal formula to cities and towns to help them with COVID-related expenses. So where's it coming from? The federal government.
Is that part of the 1.25 billion?
No, it is a separate federal, I forgot the name, but it's a separate, yeah, do you know the name?
It's part of the CARES Act, but it's not part of the
Okay, so it's on top of the $1.25 billion. Every state got it. The feds have given Rhode Island 42 million and change. It's going to be sent out by RIDE according to a federal formula to cities and towns for COVID-related expenses. Correct. It is one time.
So you've heard the issue about transportation, that there
Yes.
might not physically be enough buses or drivers. And
Yep.
so in your thinking about coming back full-time in August, that's a big blowback
Yeah.
I've heard from a lot of school districts.
Which
What do you
is
say
real.
about that?
Yes, let me say a couple things because this is confusing because there's so many pots of money here. So we've got the 42 million, which we're going to release to cities and towns from the feds. That is separate from the state's budget funding formula. And right now, we have a tough budget to balance. We're probably going to be spending all weekend trying to find out what we're going to do. And everything is on the table for cuts. And we're going to look everywhere. And I cannot promise that there won't be some cuts to that education funding formula. In fact, I think there probably will have to be, just like there's going to have to be in many places. Additionally, we hope we're going to get more federal stimulus from the Congress. And we will be able to allocate to cities and towns in next year's funding formula. And on top of that, I fully expect to use some of the 1.25 to help cities and towns with things like transportation. So that's a lot of words to say. The picture is murky. It's unclear. I fully expect, and that's why we got to get to work right now. So that's why right now, I need to know from cities and towns, what's your plan for not right now, but in the course of the next couple months, what is your plans for transportation? How much extra is it going to cost? And then my hope, plan, expectation, and prayer is that we're going to get more stimulus to help balance the budget. And then we use some of the 1.25 to help cities and towns with the extra expenses like cleaning, transportation, et cetera.
Dr. Alexander Scott, so on the data, can you just give us an update on nursing homes and the fatalities there? And is that still where you're seeing most of the deaths?
Our nursing homes are definitely working hard to address the fact that they are impacted to the extent that they are. The total number of unfortunate deaths connected to nursing homes is about 630, roughly 75%. Of the 10 fatalities that we announced today, 9 were associated with long-term care facilities. We are continuing the important work with nursing homes, making sure that the staffing support is there, the testing support. We're well into the 4th round of cyclical testing that is occurring among staff in nursing home facilities and including residents when an outbreak is connected to that. Also continuing to ensure that PPE that's needed is in place and the infection control guidance that's needed, both from a cleaning standpoint and all the way around. So we will continue to stay focused on this together with nursing homes.
Thank you, everyone.